So I had this client who sent me a message and she said, "So I have an MRI scheduled on Thursday. And what you're telling me is that there's a possibility that there is no tissue damage that will be on the MRI. And also, I still have this immense pain. Is that correct?" To which I said, "Yes, that is a possibility. No, I'm not going to diagnose you or predict or say anything like that, but there is that possibility." And I said, "Please let me know. Let me know how it goes." So sure enough, she reached back out a few days after the results came back and said with an ecstatic exclamation mark, "Oh my God, there's no tissue damage." Now, normally, this would be a real source of frustration, right? You have this extreme chronic pain that persists, and yet there's no tissue damage that shows up on the MRI. On the x-ray, the physicians are shaking their head, shrugging their shoulders, saying, "I don't know." But having this client work with me prior, and now she understands a little bit more about the brain and body connection and the messaging that goes back and forth between those. She also understands the autonomic nervous system. Those things helped her to actually feel excited because now she knew the path that she could take to ease her pain, the path she could take to influence her pain. Let me tell you a little bit more. My name is Julie Shannon Williams. I am a certified yoga therapist and intuitive guide. And this client in particular had a bulging disc at one point due to an injury she had during an exercise class. And much longer than normally expected, the pain was persisting and it was really confusing, very debilitating, hard to function in her life. So I think at all costs, she was like, "Okay, I'm going to try anything." And she reached out to a certified yoga therapist. And what we talked about was something called pain neuroscience. We talked about this pain science that is not new, by the way, but it is not studied in Western medicine. Western medicine has a full focus on acute care. If pain persists for 3 to 6 months or beyond, you're now needing chronic care. You have chronic care needs because you have chronic pain. Let me say a little bit more. Back to about the brain and body connection. So the body is actually not the source that makes the pain. The brain is. And what I mean by that is the body sends messages to the brain, either safe messages or "I'm in danger." And as you have chronic pain, and there's also something called the nervous system, we'll talk about that in a minute, also gets involved. There could be no tissue damage, yet that brain, which I like to call the overprotective parent, might send messages of pain because there's a perceived interpretation of pain. So what I mean by that is if there's danger messages being sent from the body, and what I mean by that is an overactive nervous system, because pain has been so prevalent, it's really hard to calm the mind, it's really hard to relax your breathing and release your body tension. If any of those things are occurring for an extended period of time, that is something called the sympathetic nervous system. We have the sympathetic nervous system. We also have the parasympathetic nervous system. Oftentimes in our society to date, I believe that most of us are operating out of what's called the sympathetic nervous system. And that is the need for fight, flight, freeze, any of those that you may have heard before. It is the body completely amped up. The parasympathetic nervous system, on the other hand, is sometimes referred to as the rest and digest phase. It's after a spa treatment or a yoga class or something where you sit up and you just have that soft, relaxed smile on your face. That means you're in the parasympathetic nervous system. The idea is not to only be in the parasympathetic nervous system, it's finding the balance between the two. And what was happening with this client was that her nervous system was so overcharged and her brain was continually sending messages of pain because her body was interpreting danger messages only. So what she knew, why she was excited after hearing there was no tissue damage, is she knew this was about her nervous system. This was about regulating her nervous system. And she knew that she had a way to now change and influence her pain. She wasn't just at the will of I guess this is what it is. So, if this interests you, it might be a little confusing, but if this interests you, if you are a person who is struggling with persistent pain every single day or many days, and you have not found ways to mitigate or help yourself, and you're curious to learn more about the autonomic nervous system as well as that brain and body connection, I'd be so happy to work with you on this. These are different ways you can work with me. One of the ways will be I have a pain relief cohort course. It's an online course in community with others also struggling with chronic pain, and it's a self-paced 8-week module course. The next course starts in January, so please do check that out. It goes January, February of 2026. Another option might be maybe you're looking for private sessions. If you want to do private yoga therapy sessions with me, this was a wonderful way to do it. And this would be all virtual completely. So you can do it in the comfort of your own home. Another option is I'm in the midst right now of a chair yoga series. These classes are for people with chronic pain. And those classes are September and October of 2025. And another one would be my on-demand library. If this interests you, you can go to my website. It's julieshannonwilliams.com. And if you also want to learn a little bit more, maybe you'd like to have a conversation with me, feel free to connect. There's a free connection call option on my website as well. And stay tuned to this channel. Much more content like this to come, because I believe it is in our best interest to really find different tools, different tricks that we can apply in our daily lives on this path to easing pain. I'm glad you're here. Please like, subscribe, and share. Thank you.